This is Bob Finn from the Global Medical News Network, reporting from the International Stroke Conference in San Diego. The quicker someone with ischemic stroke gets to the hospital, the better they do. That's because doctors can start thrombolytic therapy sooner. It's so important to get to the hospital within 60 minutes of the onset of symptoms that stroke experts call it the golden hour. Now, a new study has shown that stroke patients who get to the hospital within that golden hour are twice as likely to get thrombolytic therapy with TPA as patients who arrive later. Dr. Jeffrey Saver explains.
And the report that I'm presenting today looks at 500,000 patients who were treated at hospitals participating in the Get With the Guidelines Stroke Registry. There are 900 hospitals that contributed data from the U.S. over the almost 5-year period of this registry study. And it's looking at the golden hour of patients, the patients who arrive within the first hour after the onset of stroke symptoms. The analysis that we did found that there is a large number of patients who are getting to the hospital quickly. During this time frame, there were over 30,000 patients who arrived within the first 60 minutes at hospital who were having an ischemic stroke. And once they've done their bit by getting to the hospital soon, they are advantaged. They are more likely to be treated with the drug with substantial proven benefit, TPA, and to be treated earlier with that drug. We also looked at how well hospitals are doing in the golden hour patients in terms of getting drugs started quickly. We aim for the national recommendation, which is a door-to-needle time of 16 minutes, that from the time the patient arrives at hospital to the time drug is started, that optimally stretch target should be under 60 minutes. And that was achieved in these golden hour patients in about 18% of the patients, so almost 1 in 5. That means that we do have some room for improvement, that we need to, there's a natural tendency when a patient gets to the hospital early for physicians to say, we now have some extra time, we can learn in more detail about the nature of the stroke and make a little bit of a more considered and deliberate decision. And unfortunately, deliberation time comes at the expense of brain in acute stroke. Every stroke is a treatable emergency, and it is the stroke team member's responsibility to get treatment done as fast as possible. We educate our residents to push the gurney yourself to the CT scanner. Don't wait for the critical care transport nurse. Run the bloods yourself with the lab if no one's picked them up. Run to get the TPA if it's not come from pharmacy. At these hospitals, I think this data suggests, especially in the patient, if you arrive within the first hour, I think they are doing well getting TPA to everyone who's fully eligible. If you arrive in the third hour, then even though you were otherwise eligible, we often can't get it to you because you didn't get there fast enough.
For the Global Medical News Network, this is Bob Finn.